Welcome to the Medical Staff Voice Live. I'm Dr. Stan Frochtzwajg, Chief Medical Officer at Community Memorial Health System, and I'm joined today by Dr. Dr. Levitt, anesthesiologist. Welcome, Dr. Levitt.
Thanks, Stan. Happy to be here.
Thank you. This is a great opportunity for our medical staff and community to learn more about you and your practice. In doing so, we're going to ask a few questions that will help us understand and give us an enlightened insight as to what is it that you actually do in your specialty. So, first of all, tell me a little bit about yourself. Where are you from? Where did you train? What brought you to Ventura?
Well, I'm not like most of your prior guests. I'm actually an East Coaster. I was born and raised in New York City and spent most of my life there. Went to high school in New York City and then actually decided I was getting a little bored with New York and wanted to move out to sort of the Southwest. Didn't quite make it to the West Coast yet, and got to the University of Arizona for my undergrad. Go Wildcats! So that was in Tucson, and then sort of made my way back to the East Coast for medical school at George Washington University, and spent a good 4 years in that city, which I loved, and then started out in general surgery. So I did 3 years of general surgery before I was recruited and coaxed and had great role models to kind of make me look over the ether screen and bring myself into anesthesia. So I did my anesthesia training at Columbia University and finished up there and stayed on and did an extra year and a half. I did 6 months of neuroanesthesia, followed up by a year of pediatric anesthesia.
Oh my God, what a journey you've had. That's impressive.
Thanks.
Stamina to go through surgical residency and anesthesia residency.
Yeah, didn't quite make it to the end.
Right.
But still, 3 years is pretty significant.
Yeah, and we all know surgical residencies are grueling.
They're tough, yeah.
Wow, that's an impressive story. Well, I'm glad for us that we have you, and really impressed that you were able to subspecialize as well.
Thank you.
So you provide some pediatric anesthesia services for us as well, correct?
We do. Myself and 3 others, which is kind of unique actually for a community hospital because most pediatric anesthesiologists do go on to tertiary care centers, academic hospitals, but we are happy to be here. We service the community. We do pediatrics from ages of day of life 0 all the way up until centurions. So yeah, we're happy to provide that service.
Well, that's really wonderful because I know we have quite a bit of pediatrics, relatively speaking, for a community hospital, and the fact that we have pediatric surgeon and general surgeons who take care of children as well. So it's really a service that's needed. We're a very active OB hospital, so as a result, we get lots of children. It's wonderful that we have 4 anesthesiologists providing pediatric anesthesia. Wow. That's great. And so you describe what ages you treat, but you also treat adults, don't you?
Correct. That's what actually I love about my job, that I'm able to do variety, and I can start one day doing an infant and the next day doing someone in their middle aged, or and that can even be a different lineup within the day. So I'm very skilled and also very happy to be able to switch gears like that, and a lot of our anesthesiologists in the group, which I sit here representing, can do the same.
Well, that's really impressive also because each age group requires different risk evaluations.
Correct.
A lot of people don't realize that anesthesiologists are clinicians that have to critically risk stratify patients based on a whole series of factors. Anatomy, their general body type, their comorbid conditions, and so forth. So you do that with each and every patient.
Correct, and that's actually another part of what I love about my job, that we don't have an office. We do have a pre-op clinic to see certain patients ahead of time, but we are able to, within minutes, assess a patient and know their risks and figure out an anesthetic plan safely to get them through a difficult surgery that may be elective or emergent. So we have a very special skill set that allows us to do that and get patients safely through anesthesia.
And I don't think people realize also that anesthesia is not anesthesia, meaning that there are multiple anesthesia modalities that are available. General anesthesia that can include intubation or not include intubation. There are a whole array. What are some of the other anesthesia types or modalities that you use?
So just to backtrack a bit, it's important to know, I think, for patients in our community who's at the head of their bed. So we are an MD-only group, and we're proud to say that. We don't have nurse anesthetists or physician extenders doing the cases or the anesthetics. So we're there. And in terms of the anesthetic types, there's so many and so many areas, not just the operating room, we can do these types of anesthetics in. So we can start with something called sedation, which is monitored anesthesia care that allows us to get patients through some shorter surgeries, for example, colonoscopies or some lumps and bumps that may have to come off of their body with IV medication while we're still monitoring them. So we can get them in a very distinct plane of anesthesia where they're still unconscious and not arousable, but breathing on their own. And that's very hard to do. I had an attending once say some of your hardest cases are your MAC sedation cases, not just your general cases. And so we pride ourselves on being able to do that. I think the next area we can touch on is regional, which I love doing. And I'm very proud to say we have a very strong regional group here.
And regional means?
Means that we can take any nerve in the body using an ultrasound and surround it with local anesthesia and allow you to essentially wake up pain-free from surgeries. So we are doing this routinely with our joint surgeries. I just actually finished my day today doing that with certain nerve blocks with patients who had ankle fractures where they can wake up very comfortable after they've had trauma to their ankle. And the nice thing about this too is it's called a multimodal anesthetic. So we're not just giving a patient opioids or narcotics or pain medicine that can constipate you or make you nauseous. We're doing this combined technique, and what we're finding is it's helping patients do much better with their outcomes, get out of the hospital earlier, have less complications and side effects. And the other thing, I think it's a great push because, as you know, with the news and the opioid epidemic, we really want to try to get away from patients getting addicted to those kinds of medications.
You really bring up a lot of important points about the balanced anesthesia approach to caring for patients and the improvements that have occurred. I've been practicing, I don't mind saying, for over 40 years now, and I cannot believe the difference between how much more comfortable people awaken from anesthesia now compared to the way they did many years ago. Such an improvement in refined techniques. And anesthesiologists are not just located in the operating room. They're throughout the hospital. For example,
we're everywhere. We cover labor and delivery, which is a great spot when women come in to have their babies either naturally or via C-section. We can provide epidurals and spinals so they can stay awake for their babies to be delivered. And that's a very satisfying area where they're in just distress and pain, and we are able to get them very comfortable within minutes. And then we go not just the operating rooms, we have a same-day surgery set of ORs that allow patients to be discharged the same day. We even go off of that floor and we go to off-site areas like the GI lab, which I'm really proud to say over the last year we've truly expanded with the help of obviously CMH and nursing. We've been able to set up a fully functioning operating room down there to have the gastroenterologists do things like ERCPs, which are important to get gallstones out of the duct system, or colonoscopies and endoscopies. So we do all sorts of things. We even go to the radiology department and can provide anesthesia there. So we're portable. We can go anywhere.
And I know you go to the emergency room to help out as well.
Yeah.
And were instrumental during COVID for emergency interventions and intubations to help people breathe who could not breathe 24/7. People don't realize anesthesiologists are there at the drop of a hat, day and night, saving people's lives.
Correct. I'd have to agree with you 100%.
Well, I'm so pleased to hear that, and And our anesthesia group has been with us, the same group, for decades now. So that continuity of management, the continuity and involvement within the medical staff is invaluable for developing collegial rapport from doctor to doctor, the ability to coordinate and communicate the needs of the patients.
I have some great interactions with the doctors here that, as we spend more time here sometimes than we do with our families. And so it's really great to have that rapport. And if I have a patient that I'm concerned with, for example, putting them to sleep and having some risk factors, I can call the surgeon up. I can find him in the hallway and really talk to him about that. And he really values not just my opinion, but the opinion of our department. And I find that invaluable.
Well, I'm so pleased to hear that and be part of that. It's really comforting to me, not only as a physician, but as a patient. So thank you.
Great.
We know now in great part what you do in your professional capacity. We're also interested, do you have a life, like you said, and perhaps not as much as you do here, but outside of the hospital, do you have any hobbies or interests separate from medicine?
Oh, yes. So I can't get through the day without talking about my dog. I was one of these people that actually got a dog during COVID, and he has been such a joy. He's now a little over a year. His name is Angus, and he's a mini Goldendoodle. And he's got such spunk and energy, and so my husband and I love taking him out on long walks and to the beach, and we've met other dog owners and people through him, and it's been great. And my husband's an avid hiker, so I'll go along with him on some hikes, and he's also a big music fan. That's where Angus's name comes from. So we go to concerts, and we love traveling. Obviously, it's been curtailed with COVID, but we do all those fun things together.
Well, and we have great places to hike locally, right?
Love Ventura.
Carmen Canyon.
Yeah.
What better areas can you go to?
Well, that was one of the reasons why I moved out here, was because of the weather. I said, my husband was working in New York City, and we said, why are we going to wait till we retire to enjoy the weather and life? And so that's what got us out here, and we've been so happy ever since.
Well, that is nice to hear. What I've heard so much of, the attraction of Ventura to so many people. Thank God we've got that here to attract people of your caliber and quality. Thank you. So this is the kind of a third transition, favorite part for me, because it's a stream of consciousness, no right answers, just gives us a little insight into your personality. You've probably seen some of these, but we change them up. First of all, early bird or night owl?
So I used to be a night owl, but now because of my job, I've very much become an early bird, even to the point where I get up early to go to the gym before work.
Oh, very admirable. I love that. Just the opposite. French fries or onion rings?
Oh, definitely French fries. Can I add truffle fries to that?
Truffle? I love that. I've not heard of that. Now, is there one person that you can cite in your life that you truly admire, and for what reason do you admire them?
I'd have to say my mom. She's no longer with me, but she was so loving and honest and a hard worker, never went to college, and just was a really great person.
Dedicated to you and the family.
Dedicated to raising 3 kids.
Well, I've always felt it's the toughest job in the world, and so you were very fortunate to have somebody like that.
Oh, she's great.
If you had a choice between 2 superpowers, invisibility or flying, what would be your choice?
I'd have to say flying. I like to get places fast.
Well, that'd be one great way to do it.
Supersonic flying.
Oh, wow, I like that. Be specific. Your longest road trip was?
Actually, to Yosemite.
Oh, really?
Yeah, and we just did that a couple of years ago when we moved here. Yeah. I think
great.
6 hours was probably the longest road trip.
Well, and what a great place to go to.
Oh, it's so beautiful there.
It really is incomparable.
Yeah.
Podcast or reading a book, and which one would be your favorite within that genre?
So I'm very much a multitasker, and I would have to say, and that's what I do a lot in the OR, so it kind of translates into my personal life. So I'm going to say podcast because I can listen to it and work out at the same time or take my dog for a walk.
I share that experience, and can I dare say which one do you particularly like?
Oh, of course, this one.
You're great. And if you had a choice while you're on your road trip, driver or passenger?
Oh, definitely driver. In fact, when I'm not the driver, I'm still the driver.
Well, how fortunate your husband is that he gets to see the scenery. Laundry or dirty dishes?
Oof, that's a tough one because I don't like either. I would have to say dirty dishes because I can slack on that and put them in the dishwasher.
Hey.
You have to sort the laundry and make sure things don't get messed up and delicates, and so it's tough.
I hear you. That makes sense to me. Had you not become a physician, did you have a backup plan?
Oh yeah, I was going to be an artist.
Oh,
Yeah,
wow.
I was accepted into a high school art school in New York City, and I chose to go to a more collegial prep school, and I still kept it as a hobby, and I'm grateful that I did. I don't know where I'd be if I was an artist today.
Well,
but
are we talking painting, sculpting?
I did everything. I painted. I didn't do sculpting. I did painting of all sort of mediums. Towards the end of my college years, I actually got into photography a lot, and I really enjoyed that. So maybe when I retire, I'll pick it up again.
There you are. So last question, and I find this one of the most interesting questions, and that is, what would be considered most interesting about you that we would not learn from your CV?
Okay. So I'm from Queens, which is one of the boroughs of New York. And typically, if you're from Queens, you're a Mets fan. And I grew up in a household full of Mets fans. And I cannot, sorry to all you Mets fans out there, but I'm a Yankees girl. And I don't think anybody would pick that up.
It's out there now.
Yeah.
Thank you.
Yeah.
Thank you. Well, thank you for tuning in to learn more about Dr. Laura Levitt. For more information on all the services and specialties offered at Community Memorial Health System, visit cmhshealth.org and be sure to like and subscribe for more from your community health system. Thank you, Dr. Levitt.
Oh, thank you.
You're sure welcome.